All right, let's get into the list. Number one, there's no requirement for a C&P exam to be conducted. If your medical records clearly show how and when your condition started and how severe your symptoms are, and how those symptoms affect your ability to function, then there would be no need to have a C&P exam. If you provide a diagnosis, a DBQ, and a nexus letter when you file your claim up front, this might be enough evidence so that a C&P exam wouldn't be necessary to do, and this happens. Question number two, is a comprehensive exam necessary with all C&P exams? In many cases, the VA may only have a few questions about specific matters, and they have all the other answers. So if this is the case, the C&P exam may only last for a few minutes, like five or so. I've been to 5 C&P exams, and I was out of all of them within a half hour. Hour-long C&P exams are rare, although, it could happen to you. It really just comes down to the medical evidence you provided when you submitted your claim for benefits. Thereafter, the DBQs, so they can check out all your symptoms and figure out where to rate you. If you don't give them enough information, they're going to want to send you to a doctor that can help them with that info. Number three, is an examiner supposed to accept DBQ, notes, records, or x-rays directly from the patient? So the VA is the one that ordered the exam for you and they paid for it. The doctor they hired is there to check what the VA wants him to check. He's got a certain amount of time for you, window, whatever it is. And if you show up with a 22-page DBQ along with 5 pages of graphs from a nerve conduction study or something, he's probably not going to look at it right there on the spot. You could try, but there's no guarantees that he's going to do this. Most of the time, if you submitted those records to the VA, he will already have a chance to look at all that kind of stuff. If you're not sure, it's your responsibility to get them to the VA, and you need to send them to the Evidence Intake Center, preferably certified mail, right? The green card receipt. Number four. Is an examiner required to use certain instruments to measure things like range of motion? In a lot of cases, the C&P examiner will pull out a plastic tool to measure your range of motion. The tool is called a goniometer. I think I got that right. And if he's telling you numbers and he didn't actually use something to measure those numbers, there might be something there. He's also going to be observing you the entire time, including when you get out of your car in the parking lot and when you're in the waiting room. So be prepared to be observed the entire time, and then you'll be good. Number five, will the C&P examiner tell you what percentage you'll be rated at? So the examiner is not there to discuss compensation with you, and really there's no way for him to know how this particular exam is going to fit into your overall rating. He doesn't know, so don't even bother asking. It's possible for him to say that he thinks that your condition is getting worse if you're filing for an increase, but don't count on it. He's there to check things, just make his job as easy as possible, and help him check them and be polite. Number six, the examiner's report discussed things that they didn't actually check or observe. The examiner has sent your medical records prior to your C&P exam. There'll be a few things that he might not need to physically check you for because it's already in your medical records and it's documented. So you're going in for a physical check, but he might not physically check you for everything because he already knows based on your record. Can I refuse to be seen by certain examiners, or can I just, outright refuse to do a C&P examination? It's a free country, and you're free to refuse any medical exam you want, and you can refuse a lot of things. Refusing your exam or not showing up to an appointment is almost a surefire way to get your claim denied, and it might end up causing a reduction if they have the evidence to reduce you, and that's one of the purposes of this exam, is to see your level. So keep that in mind. Can I reschedule my C&P exam? This one gets tricky, and I totally get it. You file for a claim, and you have a busy life and a busy schedule. One of these C&P exam companies will call you up and say that you're scheduled for this date and time, and this might not work for you. You have life and lots of other stuff going on. I suggest that you make it and don't attempt to reschedule. It's a slippery slope, and many veterans have problems with their claims in this area. The VA doesn't care about your schedule, and they don't really care about your life, and they're not understanding. So this one's tricky. I know it's a total pain in the ass. Go to all the exams, show up to all your appointments, make sure your address is updated, and just go through this process. It's coming. Once you're through it, it's done. There's no, there's other time constraints, but not like these C&P exams. Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/nexus letters. Click on that link, fill out the form, boom, you're done.